Hello everyone, welcome back to 366 Days of Hope. My name is Pearl and I'm here to share our next topic. Now, I know I mentioned that I was going to continue on talking about minerals, which I am, but because someone ended up sending me this in my DM about vitamin B12 injections, I felt like I should just address it in this video because of the fact that it's still dealing with the topic of vitamins. And so just taking a minor break from kind of doing a whole specific vitamin introduction, I wanted to talk about vitamin B12 injections since that was the topic that was sent to me. And I'm just going to give my personal opinion. No, I am not a doctor, but as a personal trainer, have I encouraged people to take vitamin B12 injections? The answer is no. Do I suggest that people take vitamin B12 injections? No. And do they have their benefits? Maybe. I don't know. And this is where I think it is upon the person to do their due diligence to research it and make sure that the facility in which they're getting it at is safe. Because the video that was sent to me about it was this one right here. And in this particular video, the young woman actually ended up experiencing a terrible ramification for taking a vitamin B12 shot from the place that she did. And apparently she'd had them before, and then she went ahead and got them, and it just spread. Now this video was put up like 2 weeks ago, so it's quite fresh in terms of that, but she's actually on Instagram and on TikTok, I believe, and so she's talked about her experience with this, and I guess is just being an advocate of trying to encourage other people to be mindful and aware. Now, my personal take on injections. Now, please understand, I am not discussing about like injections. When I say injections, I'm specifically talking about supplement injections. I'm not talking about like medical needed injections. For example, like an IV drip. Like, yes, they're going to inject you with, important nutrients that you need if you are nutrient deficient, and to maintain the nutrient levels or your electrolytes or whatnot. So I'm not talking about that. I'm talking specifically about this B12 injections and any other enhancing, cosmetic enhancing ones as well. The thing is, the way I personally see it, if it's done in a way that is unnatural for us to absorb it, then it probably best to say that it's not the right way for you to obtain whatever nutrient or benefits from it. And I'm probably going to get flack for this, but I'm just being honest. As a personal trainer, I've seen what fitness can do to people, and as a personal trainer who has struggled with a little bit of my body image, especially when I was younger. For many of you guys who know, I was bulimic, I was anorexic. I'd gone through my stages of those kind of mental issues and body issues. So when it comes to fitness, I've seen that there's definitely a lot of vanity, and I hate to say it that way, but I just think it's very plain, but it is vanity, that where we just get so caught up on our appearance and we think that that is the most important thing, and then we sacrifice health for the benefit of some sort of cosmetic alteration to our bodies, and in the end we suffer, and it's not worth it. I've seen people talk about injecting their butt with some chemical to enhance their booty, or the things that people are doing to their lips so that way their lip looks more plump, whether that's injecting it with some sort of, again, another chemical into your body. These things that you are injecting, I've seen multiple videos of people who have done things to their bodies where it's done the absolute opposite of what they intended for it to happen, all because they have been lured into a fad. And I feel so sorry for this woman who had to experience this and is now experiencing this situation because it's not worth it. When you think about your health, and I say this from a the perspective and the mindset of loving who you are and loving your body of where it's at. Like, yes, there has been transitions in my own personal life where I've seen my body not perform or not be where I wanted it to be, and I have thought to myself, oh, well, maybe if I consider, doing this to my body or changing this about my body, maybe I'll feel better about myself. But then when I've seen some people around me who have had those very things done, and I see the agony and the pain that they've experienced from it, I'm just like, you know what? I think I need to learn to just love where I'm at. And please, I am not saying that any cosmetic things that you do is me judging you. I am not. But if you already have a healthy body where you physically don't need these alterations, then I just feel like then your addition may not even satisfy the goal that you have, and it could retroactively do something worse. And that's something to keep in mind. And so I feel for people who have done things surgically, who have done other things that now has destroyed their body, and things have changed a lot for them. And so again, my thing with the vitamin B12 specifically is, unless you've spoken to your doctor and you have been told based on lab results that you are vitamin B12 deficient, then maybe consider doing it. If you sense that possibly you might have it, then stick with a supplement at first. But I think that we can get too addicted to the idea that I want a quick fix. And I think that's the culture that we're in, that we need to try and avoid inculcating into our own minds about what hard work looks like and what trying to attain for ourselves. Because even for, especially I feel that personal trainers probably have experienced this, but I think for us, we eventually get to a level where we realize it is no longer about aesthetics, but it's about just being healthy and feeling good about where we are physically, in the time and space we live in. And what I mean by that is that if, say, I'm 25, well, I think at 25 you have a different mindset, but maybe it's because I'm older. But I would say that even if I was, say, 25, but being able to look at myself at 25, loving myself, and not feeling like I, have to meet a standard, have to constantly comply with whatever fads are happening, but that I would rather be healthy and looking at it at a perspective of someone who's much older going, gosh, I wish I could move like that, and I no longer can't. And I think because I've worked, and I should say worked, because I work with people who have Parkinson's, I have had a greater sense of appreciation of what my body is capable of doing and what it is still doing, that it's changed my perspective on what health actually looks like. That, health for me is being able to get up on the counter to get a dish from a high area, because I am vertically challenged. It looks like being able to, get on my knees, to scrub the floor and not have aches and pains when I get up. It's not having back pain. It's being able to, go up and down the stairs with no problem. So these are what has changed for me personally as a trainer, to look at health completely differently, and me seeing that, hey, you know what, by 50, my goal is by 60, I still want to be able to do a cartwheel. And so it's just looking at these kind of movements versus just like looking at, what do I look like? I mean, if you maintain a healthy lifestyle, your appearance will, I guess, in a sense, follow you. And you'll look great for your age because you're doing things consistently, eating healthy, exercising, or doing intermittent fasting, getting some sunlight. I mean, all of these different things that really help your body. And so, with that, I hope it just encourages you guys to not fall victim to all the fads that you hear out there, like the quick fixes. Please, your body, I tell people this all the time. If it took your body 15 years to look the way that it does, and you want to try and change it overnight, it's not going to be possible. It's going to take at least 2 to 3 years for you to probably get to where you really want to be and how your body's going to be truly transformed. Be patient with your body. Be willing to love on your body through the journey, and don't keep beating yourself up over it. And so, guys, yes, we are going to continue on with our minerals series. It's just going to be a hot mess for me to try to get all of that since I have so many things going on right now, but I will definitely try to maintain my 366 days of hope. And I just want to say thank you guys for all of the new subscribers that I have. I was so blessed because honestly, I just one day happened to look at the numbers and saw that there was like a huge jump, and I was just like, what? Is that for real? So I just wanted to say thank you guys for getting on here and just listening to these. And I really hope that it just encourages you to just have this mentality of health and to really push yourself. And if you have just been blessed, I just hope that you just share these and to hopefully encourage somebody else to not, make drastic choices and not do it on impulse. For especially when it comes to your own body, and not to put foreign substances in your body. Make sure you do your research. Talk to a doctor, please, or a physician if this is something that you feel you may be experiencing. It's best to make sure that you have the proper diagnosis before you take those things into your own hands. But even as a personal trainer and someone who really encourages a plant-based diet, but understands that not everyone can due to whatever they've done to their gut health. Sometimes some people can't absorb certain things because of that. I'm very understanding. However, I just really want to emphasize the importance of maintaining your health through as natural of a method as you can, and your body will thank you for it. With that said, guys, may you live, thrive, and be healthy. Take care.